Hi, my name is Pat, and today I'm going to show you how to give an intramuscular injection. I have been a registered nurse for over 40 years and have given hundreds of these. And in the last 2 years, under the direction of Dr. Gates, I have been injecting myself with the B12 and lipotropics injections, and I have been very, very pleased with the results. First, I want to show you the different locations or on the body where intramuscular injections should be given. The first would be up in the arm, in the deltoid muscle. The next would be in the gluteus maximus in the hip muscle. And when we inject this site, we always have to be very careful to avoid the sciatic nerve, which comes from the spine down through the center of each buttocks. So we want to go way over to the side of the buttocks area where this muscle is hard and firm. The third injection, which is the most appropriate for self-injection, would be the area in the front and slightly to the side of the thigh muscle. Those are the three primary sites for intramuscular injections. One cautionary statement: never inject into the abdominal muscles. These are inappropriate for intramuscular injections. Before we give an intramuscular injection, we always wash our hands, collect and assemble our supplies. We would need a syringe. And as I unwrap my syringe, I like to make sure that the needle is securely attached. As you can see, this one wasn't. Turn the needle or press in tightly as you unwrap it to make sure it's secure. Then collect your vial of medication, an alcohol swab or cotton ball, and if you like, a Band-Aid. Once we remove the needle cover, never touch the sterile needle to anything except something that has been cleansed with alcohol, such as the vial or the cleansed skin. Once the needle cap is removed, we can cleanse the top of the vial, pull back to insert air into the syringe, the same amount of air as I will be drawing up into the syringe. Insert the needle into the vial and then inject the air into the vial. Slowly withdraw the fluid to the desired dosage. And as you can see, often when you withdraw fluid into the syringe, you get little air bubbles. And the way to get rid of the air bubbles is to tap gently on the side of the syringe and inject them back into the vial of medication. Then withdraw the needle, again being careful not to touch it to anything else. Then go to the skin, cleanse it with an alcohol swab, support the muscle, throw the needle in quickly like a dart, pull back on the needle to make sure there's no blood. That tells us that we're not in a vein or an artery. Inject the medication and pull back again while supporting the muscle. This helps decrease the pain given to the patient. And the quicker the needle goes in, the less pain is involved. If desired, you may want to cover the area with a Band-Aid after you have properly disposed of your needle in a hard plastic container with a cap, anything approved for sharp disposal. The Band-Aid is available then in case there's a tiny bit of blood at the injection site. The injection in the hip muscle would be drawn up the same way, injected, as I said, into the upper outer area of the muscle, cleanse the area, inject it, throw the needle in quickly while you support the muscle, pull back slowly, then inject and support the muscle while the needle is withdrawn. You may apply pressure, but don't push or rub the site. Dispose of your needle and replace with a Band-Aid. This is so quick and easy. I know it can be done in the home on a regular basis whenever it's necessary. Now I'm going to show you, though, how I give it to myself. Okay, I'm going to give myself an injection into the thigh muscle. I'll show you how easy it is. The hardest time is a little scary the first time, but after that it becomes very, very easy as long as you remember the principles. Cleanse the skin, support the muscle, throw the needle in quickly like a dart. Again, withdraw slightly to make sure there's no blood return. Inject. And again, support the muscle as you withdraw the needle. This is so easy. I'm so glad I learned how to do this and forced myself to learn how to do it, because it saves me having to ask other people to help me. But if you have any questions and you want to try it yourself, there's a good brochure that accompanies every vial of medication from My Diet Solutions, and there's a step-by-step instruction on the entire process in the leaflet. Good luck, and I hope you enjoy your results too.